More than 3 years after being put into place, the COVID public health emergency at the federal level will come to an end on May 11th.
The White House made the announcement today with COVID rates declining and treatment options more available coast to coast. CBS 8's Richard Allen looks at what ending this emergency could mean for many families and why the White House made this action today.
Well, that's right. The White House says it's giving more than 3 months notice before ending this public health emergency so that hospitals and health providers have time to prepare for a number of changes. This COVID public health emergency, first established nearly 3 years ago under then-President Trump, has allowed the federal government to provide free COVID tests, treatments, and vaccines for most Californians, covered by Medi-Cal and Medicare, as well as private insurance. Once the public health emergency ends, some Americans may have to start paying at least partially for some of these items.
I don't think it's going to be that big of a difference.
Dr. Kaveh Bamanpour of Sharp Community Medical Group here in San Diego says when it comes to getting the COVID vaccine or booster, he doesn't expect major changes.
We know that most of the vaccines, they're covered by insurances. So if you have insurance, no matter what, if it's Medi-Cal, Medicare, or private insurances, you can get the vaccine. It might be some co-pays or not, depending what's your plan.
However, when it comes to COVID treatments like Paxlovid, an oral medication for moderate to severe cases of COVID, there may be more of a difference.
Now it's free for everybody. If you have infection and prescription, you go to the pharmacy, and regardless of your insurance status, you can get the medication. That medicine probably it's not going to be free like that.
A separate COVID national emergency, which allowed FEMA and the Pentagon to help deploy medical supplies and vaccines, will also end on May 11th, according to the White House, which said in a statement, quote, "An abrupt end to the emergency declarations would create wide-ranging chaos and uncertainty throughout the healthcare system, for states, for hospitals and doctors' offices, and most importantly, for tens of millions of Americans." And at the state and county levels, the COVID state of emergency is now set to expire on February 28th. The county's public health officer, Dr. Wilma Wooten, is expected to give more details on this at this February 7th Board of Supervisors meeting.